Hello, and welcome back to Mammalian Anatomy and Physiology. What we're going to do here is we're going to continue our conversation about the compartments of the limbs. And here, rather than focusing on the upper limbs, we're going to look at the compartments of the lower limbs. So just a quick reminder, muscles love to be organized neatly and tightly in the limbs, and it's going to do that using dense fibrous connective tissue. These compartments are going to have muscles that have a similar insertion and origin, and therefore have a similar action. In addition to that, they're going to be innervated generally by a single nerve. So let's continue our conversation. All right, so first what I would like to do is I would like to go over the compartments of the upper leg. And again, these PowerPoints are available to you on Moodle, and so you can go back to these slides as need be. And rather than focusing on the text, I'm going to show you what these compartments look like in a diagram. Something to take a note of is that when we looked at the compartments of the upper limb, we saw that the brachial region and the antebrachial region, so the upper arm and lower arm, both just had an anterior and posterior compartment, so they just had two. The leg, on the other hand, actually has three compartments in the thigh, and then another three compartments in the lower leg. So let's talk about these compartments together. Whew. This is quite a diagram, a little bit complicated. So let's kind of break it down and see what we're really looking at. So again, what we're doing here is we're taking a transverse cross section of the upper leg. So we're kind of cutting the thigh and looking at the cut end. And so let's kind of orient ourselves to some of the bones that are located in the thigh. Where is my cursor? There you are. Over here, what we have is the femur. The femur is the bone of the upper leg or the thigh. And we can see that this area is going to have three compartments: an anterior compartment, a posterior compartment, and a medial compartment. So this area is going to be like in our inner thigh. So let's first look at the anterior compartment. The anterior compartment is going to contain muscles that are part of the quadriceps groups, or so when you're working out your quads on a really hard leg day, these are kind of some of the muscles that you're working out. The quadriceps group has kind of four muscles in it, and so hence the name. We have the vastus lateralis on the lateral side, vastus intermedialis, which is a little bit deep, and vastus medialis, which is going to be more in the middle, closer to the inner thigh, and the rectus femoris. These muscles are going to kind of work together to extend the knee, and so it's going to straighten out our leg. And they can actually also flex the hip, so it can kind of bring our hip upwards. So if we wanted to pretend to be a pirate, you know, and put our one leg on top of a table. I know I'm weird. You would actually be using your quadriceps group to help you do that. These muscles are going to be innervated by the femoral nerve to be able to perform those actions. So this would be the anterior compartment that contains the quadriceps muscles. Our posterior compartment is going to contain the hamstrings, and the hamstrings are going to be located kind of on the back of our thigh, so the posterior part of our thigh. And what they're going to be responsible for doing is they're actually going to flex the knee. So it's going to kind of bring our leg back. And it also is going to extend the thigh. So we can kind of kick our leg backwards a bit. So those would be the hamstrings. These muscles are going to be innervated by the sciatic nerve. If you want to go the extra mile, you can say the tibial nerve, which is a portion of the sciatic nerve, but I am okay with you just labeling it sciatic nerve for now. So that's the posterior compartment. The medial compartment is going to be closer to our inner thigh, and it's going to contain the adductor muscles. So these muscles are going to adduct the hip, so it's going to kind of bring our knees together and have our knees touch. So it always reminds me of that really cheesy kind of 80s workout, like the Thigh Master workout little machine. I don't know if you guys remember it. You guys are much younger than I am. But that little 80s machine works out your adductor muscles. And so it'll bring your knees together. What will happen is these muscles are actually innervated by the obturator nerve. I'm going to give you guys a quick moment to think about, oh, I have heard obturator before. Can you remind yourself where you've heard that word before? Yes. Obturator is actually the big hole that is in the pelvis, in the coxal bone. And so the obturator nerve will actually thread its way through the obturator foramen. Awesome, exciting, exciting. So just as a quick review, we have the anterior compartment located here with the quadriceps muscles. Over here, we're going to have the hamstring muscles. And back here, we're going to have, over here in the medial compartment, we're going to have the adductor muscle group. Weird fact, hamstring actually comes from an old 1800s butcher term. When they used to actually cut pigs' legs, they would actually string a rope through the hamstring. So that's where hamstring comes from. Ham meaning pig, and string, the string that used to kind of hold up the pig's leg. It's weird, it's kind of gross, but if you wanted to know, now you know. Yeah. All right, now let's go to the compartments of the lower leg. The compartments of the lower leg are going to also be an anterior and posterior compartment, but rather than having a medial compartment, we're going to have a lateral compartment. So this is going to kind of be away from the midline on the outside of the lower leg. Ooh, another kind of complicated diagram, but let's break it down together. So in this situation, we're going to be looking at the lower leg over here. And again, what we have done is we've taken a transverse cross section through the lower leg to see, oops, let me get back to that image. There we go. Nope, wrong one. There we go. Over here, we're going to have the transverse cross section of the lower leg. And we're going to have kind of three compartments here that are going to allow the lower leg to move the foot in a number of directions. So let's orient ourselves. Over here, what we have is we have the tibia. So this is going to be the shin. So if you feel your lower leg, you'll feel a little bit of a bony part right in front. That's going to be your tibia. And so this area over here is going to be the anterior part of the leg. And over here is the posterior part of the leg. And here is going to be the lateral side. Okay, so we have three compartments here. We're going to have the anterior compartment located right here. And the anterior compartment is going to have muscles such as the tibialis anterior. And essentially, these muscles are going to be responsible for flexing the foot, and specifically doing dorsiflexion, where you kind of create an angle with your foot. And it also is going to extend your toes. So it's going to bring your toes up. So this will dorsiflex the foot and extend the toes. If you kind of wiggle your toes around, you can actually feel these muscles contracting to kind of orient yourself to what's going on underneath the skin. These muscles are going to be innervated by the deep fibular nerve. This is again going to be a portion of the sciatic nerve. In the back over here, we're going to have the posterior compartment, and the posterior compartment is going to have the digital and plantar flexors. So what does that mean? So to plantar flex means to actually like point your toes and kind of push the bottom of your foot into the floor. And so ballerinas are going to have some nice plantar flexors of the foot, so they can curve their foot really beautifully when they dance. And it's also going to contain the flexors of the toes. So when these muscles contract, it's going to curl our toes in. And all of these muscles are going to be innervated by the tibial nerve. Again, a division of the sciatic nerve. So the anterior part, just to review, is going to dorsiflex the foot and extend the toes, while the posterior compartment is going to plantar flex the foot and flex the toes, so curl the toes. On the lateral side, we're going to have the third compartment, and this third compartment is going to be responsible for plantar flexing the foot, so it's going to aid the posterior compartment, and it's going to evert the foot, meaning that the bottom of the foot will actually kind of turn more laterally, and so it's kind of like rolling your ankles in to be able to do these motions. So that concludes our discussion of the different compartments of the lower limb. So again, I can't stress enough, don't learn every single muscle and every single nerve unless you're really, really excited about this kind of stuff. I'm never going to tell you not to be excited about learning. But what I expect from you on your test is to know one compartment really well. Know what muscles or general muscles are located there, what nerve innervates it, and what's the action of that compartment. Thank you for spending time with me over this lecture, and I hope you find it helpful. If you have any questions or concerns, please feel free to email me or ask questions during our Microsoft Teams meetings. And I hope you have a great day. Be good to yourselves, and I will see you in the next video. Bye-bye.